And I'm the project lead for BSOL Mental Health NHS Foundation Trust. In our trust, we see a lot of patients with severe mental illness, and we arrange for nicotine replacement therapy, and we provide them with the behavioural support, which is CBT, and motivational interviewing.
My name is Hilary Waring, and I'm Director of Improving Performance in Practice in the Tobacco Control Collaboration Centre. I take the national evidence base and try and help places like Birmingham to turn that into action that is meaningful with their local populations.
So I'm Martin Lever, I'm the Tobacco Control Lead at Birmingham City Council. The Tobacco Control Alliance, which is Birmingham and Solihull, we bring together all the essential components of tobacco control. That includes smoking cessation, but also the prevention work and the regulatory work that we need to do, because that will help us get us to be a smoke-free 2030.
My name is Mary. I'm the Senior Program Officer in charge of the Smokefree Generation for Birmingham City Council. It was a big program, and lots of people come in. We have the CMO come around, who was in the video conference and was supposed to speak to us on youth vaping and all the efforts everyone is making in the country for smoking cessation.
It's great because we're all busy with our day jobs, and what I think the thing I've learned through being here is how many people we've got working across smoking cessation, all of our partners, we've got public health, so everybody's in the same room, and it's really good, I think, to get everybody together because they can see how they fit into the bigger picture.
It's great. It's amazing to see so many people so committed in one space, and that however much I've been around tobacco control and smoking cessation, that today I've learned things new, which is great.
It's been brilliant. It's been really interactive, lots of sort of fresh ideas flowing in as well, and a lot of insight from different professional areas.
To keep our foot on the pedal and just keep going with this, because there's so much more to be done. We're making a lot of progress, but we need to keep going.
We're doing a lot. Yeah, but there's still more to be done. There's a lot of collaboration that we could do to collaborate with those in the community sector, voluntary sector, and having a more one-door approach to smoking cessation rather than having pockets of work, just not silo, but the community, and strengthened efforts, from everyone, acute and community setting. Yeah.
I think we need a good tobacco plan that allows everybody to understand their role and to know how well they're doing.
Keep bringing the partners together. I think we appreciate and value the work that everybody's doing, and I think that today what it's done is it's brought people together and people can see the bigger picture and how their contribution matters. So we're all in this together. Public health can't do it without the broader community, without the voluntary sector. So I think the fact that we're all working together is really good, and we need to focus on keeping that momentum.
To get the local community to start to talk about smoking and not just the healthcare professionals. So we've focused a lot more on the healthcare sector, that doctors have these conversations, nurses have these conversations, but it doesn't have to be limited to that. We can get people from the local community who are closer to the population to have these conversations. And I think everyone should be having these conversations with their sort of close friends, families, and it doesn't have to be that, you have to stop smoking, but just that, support is available if you wish to, and when you wish to.
I think it's made a real difference. It's given lots of cities, and including Birmingham, the chance to do things that just with the ordinary funding they just wouldn't have been able to do. So it's allowing us to put our foot on the accelerator and do more.
For the grant, we were very limited to inpatient settings only, but once we had some funding, we were able to sort of expand into the community setting, which is roughly 32,000 more people that we could see, that we could screen for the smoking status, and potentially provide support to them.
Smokefree Birmingham, to me, looks like we obviously keep working on reducing smoking prevalence, preventing young people from starting smoking. We need to widen our work on youth vaping. All of this wonderful work we're doing, supporting our smokers to stop. We need to continue with that, and the Smokefree Generation additional funding is really helping with that. And I'm so pleased that we're doing this additional work with rough sleepers and with our community mental health hubs.
Having a prevalence of smoking below 5%, having more of smoke-free spaces, in not just public spaces, but more, just widened, having fresher hair, cleaner hair in the community, and not just that, of course, the health outcome that comes with this, having improved outcome for those that have respiratory illnesses.
I think it's one where we see less disease that's linked to smoking. I think it's a place where you can walk through the city and not see anybody smoke. I think it's a city where we're seeing more babies born healthy and alive because we've helped their mums not be addicted to something that really harms them.
Well, for me personally, I'm a former smoker and I started smoking when I was 13. I gave up a long time ago. So I have a real passion for this work. And one of the things I always say when I'm in clinical settings is that stopping smoking is life-changing. And it's something, it's so important. People can breathe again, more money to spend. There's so many benefits from stopping smoking. And I'm really committed and passionate about that. So.